All right, people. Thanks for tuning in to episode 2. I think I got us pretty far. I've now been in the hospital about 6 days, 5 days. But this next section is really about the 24 hours post being checked in. I just want to kind of give a little bit of more context as to why the treatment went from uh, 0 to 60 real quick. So I think where I left off in the last one. We had a fairly accurate diagnosis of acute premyelolectric leukemia. I I'm gonna pronounce. It'll probably take me this whole time to pronounce that right, so I'm not gonna worry about it too much right now. And I apologize. I know I'm a few days behind in the blog, just trying to get people caught up so they're even up to where we're at. So I'm really just talking about the time period post getting down here to LDS General Hospital. Um, what Here's what set off the alarms, right? So um, the critically low pallet. And first and foremost, I really want to thank Jake Rennie, who drove me down here, who's had experience with this, who was smart enough to say, "Hey, let's start recording some of the notes with the doctors." The doctors throw a lot of big words at you. They are obviously super excited. We're going to call. They do prefer to kind of fly under the radar and not be um, stated or called out too much, but we'll call my main doctor, Dr. M. She's fantastic, and LDS, Intermountain LDS, is one of the leading hospitals here for this type of blood disorder. So as the Heber Clinic was consulting with her, um, this is what they found. Basically, in the normal platelet count that keep your blood clotting properly, mine was so low that even a small cut or bruise could have become critically dangerous, which really meant that I was at risk for bleeding out if I were in some sort of situation. The clotting agent just was so just not there, and so that's one of the things that they're tracking. Um, Low red blood cell count, anemia. This explained the fatigue. Obviously, I kind of had the thought as I was seeing the bruises. It just means that without enough red blood cells, I'm just not getting enough oxygen, and that explains the fatigue. Um, Electrics. I'm gonna see if maybe I can get my friend to read this for us real quick. Let's see if this works for us. This may do us a little bit better if it actually works. There we go. I'll get a little lesson from Snoop Dogg as we go throughout these. So um, basically, this is instead of a mature infection fighting white blood cells, my blood was filled with these immature primary um, cells, which was a huge warning sign. This was the sign where they kind of knew without a doubt that this was this particular uh, uh, this particular kind of leukemia, APL. So, what exactly is acute promyelolytic leukemia? I'm reading some of this. We've put it into ChatGPT to kind of help me as my brain gets foggy. Even today, as I just use the bathroom, I get exhausted. So, what exactly is acute promyelolytic leukemia? In simple terms, it's blood cancer. It's where my white blood cells stop developing at this early stage. Instead of growing into fully functional white blood cells, they stay immature and they pile up in the bone marrow, stopping my body from producing any really healthy red blood cells. So, translation to all of this is I wasn't making enough red blood cells, resulting in fatigue, dizziness, weakness. I wasn't making enough platelets. So the easy bruising, and I'm going to down below, you'll see some examples of your typical jujitsu bruising and some of the bruising that I was witnessing the weeks leading up to it, or the days leading up to my diagnosis here. I was making too many abnormal white blood cells, which really increased the risk of blood clots and infections. And that was the biggest thing, right? Um, this is a fairly aggressive type of genetic mutation, APL. Um, Again, I'm reading through some of the notes that Dr. M has. I just want to say, like, the care team here at Intermountain, when she speaks, there is a twinkle in her eye that, like, I can tell she has to kind of dumb things down for me, because she knows that maybe most of her patients can't keep up. But there's something inspiring in that twinkle that you're kind of, you're talking with somebody who's figured it out. In fact, she said, this is of the particular leukemias, this is the one to have. This is the one we know how to treat the best. Um, and so that's really positive. This particular leukemia has a successful treatment rate of 90 to 95%. So APL is caused by a specific genetic mutation, the PML RARA fusion gene. This mutation forces white blood cells into a developmental traffic jam that clogs up bone marrow. That's why standard chemotherapy doesn't work the same way here. So I won't be doing a traditional chemotherapy. Won't be losing my hair. It will be a ATURA, ATRA, all trans retinoic acid type of treatment therapy, which involves several different drugs within the system. So APL is only one of the only leukemias where early treatment, literally starting with hours, can mean the difference between life and death. The most dangerous part of the disease isn't the leukemia itself; it's the catastrophic bleeding or clotting before the treatment takes effect. So hence the reason they wanted me to the hospital immediately. That's why that was night one, right? Before they even confirmed the leukemia, it was all about this ATRA therapy and starting that immediately, making sure that my blood was clotting, um, that they were able to kind of patch and repair that to get me into a place where now we can start. Um, so once that starts, the survival rate is relatively um, is really relatively high for APL. So that was day one. The next thing that took place, so the very next day on March 12th, they confirmed a couple of different things. First was they did a bone marrow a bone marrow test where they actually took some core samples from my bone marrow to just confirm about 10 o'clock in the morning on the 12th. Dr. M came in and basically said, hey, we've just met with um, our team. We actually, the think tank of us, we actually believe we're so confident in our diagnosis here. We're not going to wait. We want to put you on this level of chemotherapy. Um, and they felt like that I had responded well enough to um, the clotting agents and the bleeding disorders well enough that I could go ahead and start that particular treatment. Let's see, I'm going back through my notes here. Get a couple more things. Oh yeah, so they performed this bone marrow biopsy. That was wild. They actually had to drill core sample out of my hip bone with the drill. And of course, I tend to attack everything with humor, and they didn't really find it funny when I asked if he was if he was a Ryobi man or if he was a DeWalt man. He just said it's silver and it spins, and um, doctors sometimes just don't have sense of humors. Uh, so when really what they found in that aha moment with that bone marrow biopsy was what they call the PML-RAR fusion gene, and that's the genetic mutation that kind of confirms all of the other suspicions that they already knew. It's interesting that you work with these people and they've done it so long. Um, they called it before they even really, in some ways it was like watching Bill Belichick call the perfect Super Bowl, if you will. Um, let's see. No time to waste. Yeah, that's why they rushed us in. Um, Man, maybe I'll leave it all there for now. I've been in treatment now for 4 days. I've gone through 3 different rounds of chemotherapy, or excuse me, 4 different rounds of quote unquote chemotherapy. I'll dive into that on the next post. What does that actually mean? What does that treatment actually look like? The good news is I won't be losing my hair. It's not your traditional chemo, but it is a, a specific way of attacking this disease. Um, and yeah, I'll try to get back tomorrow with the next the next segment. But at this point, yeah, we've confirmed that it is this APL, and we've gone ahead and signed the treatment planning, and we have plans moving forward to attack it, and that'll be the next section. So no quarter given to this disease. I know I've got a solid fight ahead of me, but I appreciate you all sending the good wishes, asking the questions. Oh, the question did come up: how how did I get this? It's a genetic mutation, so it's not just like I was living dormant. It could have been an environmental factor. They're not really sure um, how or why. I mean, it could be a number of different things that could have caused it, but it's not like it's genetic. It's not like it's like I pass it down. It is a genetic mutation of a particular gene, but it's not like it's genetic. It was handed down to me. It was more likely that it was environmental, something that caused those cells to switch teams. Um, yeah, please, thank you. Continue to send questions. Continue to send love. I'm getting blown up with text messages, and I'm doing my best to keep up with them, and really, appreciate you just coming to the blog for these updates and watching. And um, yeah, if you have any questions that you want me to maybe cover more, I'm hoping to get better at this as I just kind of do this in the raw, and hopefully I'll be in a better space. Won't always be sitting in this bed. I actually do feel very, very good. I'm responding well to the treatments that have been happening. I've had lots of visitors. I've been sleeping really well. And so the thoughts, the prayers, all of that stuff has really been helpful. So I'm gonna leave the video at that. I'll post some additional little content below so you can kind of see some of the difference in the bruises that I've experienced, and look forward to your comments and our continued interaction. Cheers, everybody. Love you.